it becomes automatic. It becomes so you do it almost not thinking, then you can put your attention to other layers, to other communication with the client. So your attention will be focused on not on what you're doing, but on something else. And your technique becomes more automatic. And when you does that, then you can learn something else. So go step by step. Don't be scared or afraid, as our students often are, and I see it over and over again. Wonderful possible healers, they just give up because, well, I don't understand it, I can't, I can't get it, I can't comprehend it, I can't be a scanner therapist. No, you can. It's just you educate yourself slowly and you use your strength versus your weaknesses, and don't bang your head against the wall if you can't do that. So remember that Dr. Yuri worked mostly in subjective mode. He get his 85-95% success because he was engaging client's mind at all times. He was very skillful in that. He was working with the smaller symmetries, but he was forming the smaller symmetry in the mind of a client. Okay, so your first procedure is the most important one. These are agendas on the first procedure, and you work according to the Scout's principle. Know where you are, form a goal for yourself and the client, and develop a plan how to get there. I'm not actually talking a lot about it because we already talked, Dr. Joseph taught you all that. But your first procedure is the most important in SCENAR, so it's important for you to get your lay of the land and see how deep the problem goes, what can you do, what you're willing to do, what your client can do, and what she is willing to do. And remember, form a goal, and the goal has to be specific. We told you about the Stafford's case, right? When he wanted to dance with his wife for Christmas, and that was his goal. That was his objective. So pull out the goal as concrete as you can. The goal, I want to be better, is not a goal. It's too vague. You need something concrete that your client can measure himself against and constantly check how close he or she is to that goal. So the goal needs to be concrete. And of course, know where you are, it goes without saying. And how to get there, it's a design of your SCENAR procedure, which we discussed at length before. Well, you need to activate the client. So you will be working on the first procedure a lot with the client's minds, but according to the principle of systemic interactive medicine. Mirror, connect, right? Then what? Okay. First you mirror the client. You establish the connection with them, right? Then you blend with their energy field. You go through the restructuring with them. And after the restructuring is achieved, you can disconnect. Yeah. Yes, that's it. Repeating. So, achieving the dynamics of the main complaint. Why is it important? It's because it gives your client hope. It brings trust in himself and you. So, achievement of the dynamics of the main complaint, that's why we're repeating it over and over again to you. It's the most important thing at the first procedure. Get the dynamics. Spend more time than its maybe original plan, but get the dynamics. Get the positive, satisfactory result at your first procedure, because it will be important not just for the body, it will be mostly important for the client. Second level of his mind. You may not get to the spiritual level at this point, and you may, but at least you can get to the second level of his mind and his soul. And of course, create the understanding. Now, when the procedure is over, discuss the results, point the client's attention to the dynamics, to the change that is achieved, and summarize everything, and deliver your plan. By now, you already know your plan. You have to discuss it with the client, let him know what is happening and what will be happening, and give them the advice. Give them the homework. Let them read it, and make sure that when he comes to the second procedure, he already knows. He check if he did his homework. And you have to train the client how to be an active participant in the healing triangle. Okay. This is just things that we do for if your client is in stress. That is very important to take him out of stress as soon as possible. And one of the best things you can do for that quickly is a little wings, right? And if you have a little bit more time, then do the color zone technique. You can also utilize for quick taking client out of stress what we call 11 stress points, which are very convenient to do with the small shankits. You just use 4 pairs of points and 3 single points. So the pairs of points are your TMJs area. Then you go for the projection of the internal pterygoid muscles, right here underneath the jawbone. Then you go to mastoid processes. And your 4th pair of points is basically it's a base of your skull, but not quite the base. It's these points that if you palpate, they're painful in most of you. It's on the sides of the foramen, like right here. If you palpate them, you will feel that they're quite sensitive. So this is the 4th pair of points. And then you have 3 single points, which is your 3rd eye, your atlas or your C1 and your tailbone. So this 11 points, if you influence them, and it doesn't have to be long, maybe 1 minute on each, it pretty much addresses the vagus nerve, so stimulates parasympathetic, comes down the sympathetic, and we will be talking more about it tomorrow at the chronic stress talk. And for the following SCENAR sessions, of course, you bring your client's attention to seeing the dynamics of the procedure, and again, try to force him to become active, explain what's going on, address his left brain, address his right brain, bringing in emotions, positive emotions. And at this point, well, try to dig deeper, because right now he already trusts you. So try to dig if there is underlying reasons for his conditions, if there are emotional, mental, or spiritual roots to it, and see if you can deal with that. See if you can help him or her. And the very important, extremely important thing is the last point. Now, why do you think it's important to celebrate the victories? It anchors, right? It reinforces. It brings joy and increases the self-esteem, right? It increases the self-esteem of a client. So he now starts believing that he can do it. He is powerful, he is strong. He now has a support system in you and in SCENAR. And he starts feeling comfortable, fear dissipates. So celebration of a victory anchors the victory in your mind and your client's mind. And in your mind too. You will feel better after that. Actually, I have an article. I wanted to include it, but for some reason I forgot. It's called the Drink More Champagne, Celebrate Your Victories. So it's how overall in life to achieve success by celebrating your victories more. Because we all we have successes, but we kind of, okay, yeah, what's next? And it's important to take your time and to celebrate your victory, because it will help you to be more efficient in further achievements. Not just in health, it's in everything you do, basically. Just celebrate your victories. And on that positive note, include one of the, there is a protocol called the Cinderella Beauty Treatment. So you may want to include it because it affects actually emotional and spiritual levels a lot by working on the facial muscles and releasing the emotions through it. We talked about that. And this is what I mentioned in the beginning. That's the SCENAR philosophy that Dr. Yuri wrote. And it is included, and I really suggest you guys read it. It's short, but it's very profound. There's lots of experience and thoughts, and Yuri's golden heart in it. So, on that positive note, I will thank you all for participation. I apologize, we ran a little bit later with a delay, and I hope it was useful for you. Thank you, guys.
Thank you, Dr. Irina. As enlightening as ever. Okay, I'm sure there's going to be a lot of clients that won't know what will hit them when you go back to your clinics and start connecting everything else.